Hi, my name's Eva Pott, and for my topic, I chose how chronic illnesses can lead to readmissions when not treated initially with the proper quality care. So just to give a little introduction, medical professionals that are working toward the goal of better quality and value improvement, and these are the ones that, of course, realize the disparities caused with chronic illnesses, are the backbone for chronic illness patients and sources of reliable information. And just to give you a few examples, examples of chronic illnesses, just in case you don't know, they include heart disease, diabetes, and of course, chronic pulmonary disorders. These factors are obviously concerning for the personal health of all patients that have them, and they can really put a strain on the patient's daily life. These readmissions are not only unhealthy for the patients, but they are expensive for hospital and health organizations. When patients come back with the same problem, supplies and tests are used twice to figure out the same problem if it only would have been treated properly initially. So just to give a little background, more than 125 million people will have at least one chronic illness, and 20% of Medicare patients discharged from the hospital were readmitted after 30 days. However, fortunately, the Centers of Medicare and Medicaid have reported that all 30-day readmission rates have decreased 17.8% due to improved quality care. So that's actually quite a bit of help with just a little bit of quality care. Some of the research methods I used mostly articles from the American Journal of Public Health. They have some great articles that are written by professionally by researchers and, of course, other doctors and medical professionals. And these articles, of course, were not biased, meaning they were not geared towards a nurse's point of view or specifically a doctor's point of view. I also added statistics from one or more credible sources with some keywords such as the decrease of chronic illnesses and the years of long-term chronic illnesses patients might have. And some other ones I used were quality improvement, evidence-based care, and the success of chronic illnesses. So some of my findings as I went through my research, I found that there are many ways that can be used to reduce readmissions. They include using data-driven information and statistics and understanding where readmission problems exist. And of course, not narrowing it down to a hospital-based change. Also, you can see from the chart I have here that the prevalence of chronic diseases in the U.S. will significantly increase if there is not improvement in the quality and value of care of these patients. So lastly, considerations as we're going through this and just to think about when you hear more about chronic illnesses. Chronic illnesses can be painful for many patients when they don't have the proper care and health treatments to give them the quality of life these patients deserve. It is important for hospitals and medical professionals to give the extra treatment to help with these patients, not only to help them through their daily life, to help lower pain or restlessness they may have, but also to help them with financial strain in their quality of life. And that's all I have, and here are the references I used for this scholarly project. I hope you enjoyed it, and thank you.